Good morning, everyone. Welcome to our webinar, Through the Fog, Unveiling the Secrets of Part B Billing. This is the third session in our Metascare Madness event today. My name is Ashley Decoto, and I'm a specialist with our Provider Outreach and Education team. On the call with me today is my friend and colleague, Tom Ryan, who you just heard from. Tom is going to be helping out with the chat. First, I have just a few housekeeping items to go over. We will have a recording of this session available in the Training Center on our website. The Training Center is linked on this slide, and Tom will be adding a link to the chat. And it will be available on our website for the next 60 to 90 days, barring any technical issues with the recording. And you can access this without having to access YouTube, as we do recognize that not everyone is able to access YouTube at work. Now, the recording will also be available on our YouTube channel as long as the information remains relevant and current. So that will be there for you to rewatch, or maybe you have someone in your organization that was not able to attend this particular session and wants to watch the recording. We are taking questions through the chat today, which again, Tom will be monitoring, but we may not get to live questions today. We did have several pre-submitted questions, and I'll be addressing those throughout the presentation today. We did also have a number of questions unrelated to this session, which we will not be addressing. If we don't have time for live chat questions, I will put together a follow-up email that will include answers to all questions that we were not able to get to, and I'll send that out to all attendees. We would appreciate you taking some time to provide feedback on our education, and towards the end of the presentation, you will be provided with a couple different ways to take our survey. We would love to see your feedback on this session and suggestions for future education. This is our disclaimer slide. The information given today is as up to date and accurate as we can make it. Now, as some of you may know, Medicare rules do change often. We will respond to questions based on the information provided, but CMS rules determine final coverage. The most current information may always be found on the CMS website, which we have linked for you here. Lastly, for this slide, CMS prohibits recording of this presentation for profit-making purposes. So if you are recording or taking screenshots, we do ask that you stop. Again, we are recording this presentation ourselves, and we'll have the recording available on our Encore page in the Training Center of our website within the next week or so. And again, the recording will also be available on our YouTube channel. All right, so here's the agenda for the session today. Our goal for this session is to provide information on Part B billing. This will include the information you need from your patients, what you need before you bill, and I'll talk about the 1500 claim form and 837P electronic submission. Again, we're taking questions in the chat, but if we're not able to get to those questions, I'll send out answers to those who attended. We are also holding our Frights and Insights Q&A session next week. So if you're not already registered for that, it is still open for registration. Before we really get started, we had one pre-submitted question which indicated you were looking for information on durable medical equipment or DME billing. WPS is the AB Medicare Administrative Contractor, or MAC, and does not process DME claims. So we're not going to be covering DME billing in this session. You will want to reach out to the DME MAC for your area who would process DME claims. You can find that by going to the cms.gov website, and if you search who are the MACs, that will help you locate the DME MAC for your area, which will be either CGS or Noridian, depending on where you're located. First, let's talk about what you need from your Medicare patients, or you may hear us refer to them as Medicare beneficiaries. The first thing you'll want is their Medicare card. It's going to look something like the images shown here on this slide. The top is an example of what the card will look like for original, or what's called fee-for-service Medicare. And the bottom is an example of a card for those Medicare patients who are eligible under the Railroad Retirement Board, or RRB. The card is going to look different depending on what type of Medicare they have. Some things to look for on the Medicare card are listed here on this slide. First is the Medicare Beneficiary Identifier, or MBI. You will need this as part of your claim submission. Now you may see the term HIC number, or HICN, which stands for Health Insurance Claim Number, or you may even hear it pronounced as HICN. Medicare did away with the HIC numbers back in 2020, but if you ever see HICN referenced anywhere, know that this was the patient's Medicare number, or what is now referred to as the MBI. I have seen some references out there that still reference the HIC number, and you may even see some denials that reference the HIC number. So this is just something for you to keep in mind. The patient's Medicare number is now called the MBI. Next thing I want to point out here is using their exact name. You want to be mindful of the name that's listed on their Medicare card, as this is something that could cause your claim to reject. Let me give you an example of that. Let's say Bob Smith comes in to see you, and you bill services under the name Bob Smith. But what you didn't notice was that the Medicare card listed Bob's name as Robert Smith. This will cause your claim to reject. The claim must be billed using the name exactly as it appears on the Medicare card. This is their name as it is on file with the Social Security Administration. Last thing I want to point out for the Medicare card is the eligibility dates. Your Medicare patients typically receive their cards about 3 months before their entitlement date. So if they get their card in the mail today, October 16th, but they're not eligible yet for Medicare until January 1st of next year, any services you were to bill in the interim are not covered. The other thing to look for here is whether or not they have Part B coverage. Notice on these example cards, both Part A and Part B entitlement is listed, but that won't always be the case. There may be situations where a Medicare patient has declined Part B coverage, so be sure to check that. So now that you've checked their Medicare card and they do have Part B coverage, you need the patient's permission to bill Medicare on their behalf. The patient must give the provider permission to release medical information required to process claims and must provide authorization for payment to be made to the provider. This can be done by either signing the claim form, or you are able to ask them to give this authorization by signing a one-time authorization form. If they have signed a form, this will allow you to include the words "signature on file" on items 12 and 13 of your paper claim form, or the electronic equivalent, so that you would not need to get a signature for every claim. We had a pre-submitted question that asked, how often does the claim form need to be signed by the patient? If you have them sign a one-time authorization, then you can just include the words "signature on file" on your claims. If you do not have a signed one-time authorization, they would need to sign each claim. We had another pre-submitted question that indicated you want to make sure you're collecting all the information needed from patients for accurate billing. So you want to make sure that you're gathering information from their Medicare card, which we looked at on the last slide. You're getting their permission to file the claim to Medicare, and also you want to ask if they have any other insurance in addition to Medicare. And we're going to talk a little bit more about other insurers later in the presentation. All right, another thing that the patient is responsible for is to keep their Medicare records current. So we talked about the name on their Medicare card, for example. Though it might not be common for Medicare patients, there may be situations where they've changed their last name, let's say due to a marriage. That information does need to be updated with Social Security, as this is the information Medicare uses to process claims. This would also include their contact information, such as phone number and home address. So if they move and need to update their address, they would need to contact the Social Security Administration. The next thing on our list is the Benefits Coordination and Recovery Center, which is also known as the BCRC. The BCRC helps coordinate Medicare's payments with other insurers and group health plans. And if the patient has any changes to their insurance, for example, they have a new insurance primary to Medicare, they will need to provide that information to the BCRC. If your patient has a Medicare Advantage plan, they will need to communicate any changes with that individual plan. Services for patients with coverage under a Medicare Advantage plan are not billed to original Medicare, meaning WPS does not process those claims. They must be billed to that plan, and for any changes, the beneficiary will need to coordinate with that plan. These are the resources that are designed specifically for Medicare patients. I'll show you provider resources a little later in the presentation. If your Medicare patients have any questions, they should be either calling 1-800-Medicare or by using the Medicare.gov website. Actually, let's go out and take a look at that website. So I've pulled up the Medicare website designed specifically for patients, which again, this is Medicare.gov. Your patients can come right here where it says login or create an account to create a Medicare.gov login so they can find information such as a summary of their current coverage, they can view claims, find a copy of their Medicare card, and so on. They can also find an electronic copy of the Medicare and You handbook there, if they would prefer that over the paper copy that's mailed to them each fall. You can also find that handbook if you wanted to show this to your Medicare patients. Going the wrong way here. If you click on the word Basics up here, which is a drop-down box, and here you see Medicare and You Handbook. So you see when I click on that link, if I scroll down just a little bit here, it gives them the option to sign into their account to choose, again, the electronic handbook rather than the paper copy by mail, or they can also download a single copy of the handbook in PDF form if I were to click right here. This is the Medicare and You handbook. I'm going to scroll down past some of this opening right here. The table of contents right here gives you a kind of a quick look at what your patients can find in this book. It has information on the parts of Medicare, original Medicare versus Medicare Advantage, what Medicare covers, and so on. So if your patients have Medicare questions, this is where you'll want to refer them. I'm pulling up another resource from the Medicare.gov website that you may want to share with your patients, and this is the booklet titled How Medicare Works with Other Insurance, and this is also linked on slide 11. This one explains the coordination of benefits and how Medicare works with other types of coverage such as group health plans and Medicaid. We had a pre-submitted question asking for a list of covered services, and there's not necessarily a list of covered services for providers, but if your Medicare patients are looking for this information, you can refer them to Medicare.gov. So I'm going to go back there for just a minute. So up top, I'm going to click on Providers and Services, and then you see here what original Medicare covers. So from this page, they have a few options. They can go to this first box, which is my test item or service covered? Or next to that, there are links that take them specifically to pages for what Part A covers, what Part B covers, or if I scroll down a little bit, Even here, they have this link of what's not covered by Medicare. And then they can also find a more comprehensive list of what Medicare covers in that Medicare and You handbook that we looked at. So lots of great resources here for your Medicare patients. All right, let's head back to the presentation. So we've talked about what you need from the patient. Let's talk about what else you will need before you bill your claim to Medicare. First, you want to check eligibility. You've gotten their card, but it's still important to verify that information and double check for other insurers. CMS does require that eligibility be checked using self-service technology. So what does this mean? It means you're not able to call customer service and check eligibility that way, but you have a few options to do this. First is by using our SecureNet Access Portal, or SNAP, or you may hear us just refer to it as the portal. The portal will give you access to functions like checking eligibility, as well as claim status and performing other claim-related transactions. So I do encourage you to sign up if you haven't already. We're going to take a look at the portal user manual, which provides information on performing eligibility checks through the portal. So you can get to the portal user manual, using the link on this slide, or I'm going to show you how to find that from our WPS homepage. So if we go out to WPSGHA.com, this is our homepage. To access our SecureNet Access Portal, you are able to log in right here from the top right of the screen if you're signed up, or you can also find the link right here to register if you've not signed up to use the portal yet. What we're going to do, though, is click on this link for the portal user manual. For what we're looking for, I'm going to scroll down about halfway down the page. And under patient, we're looking for eligibility. And I'm going to click here on eligibility check. And that's going to take me to this section of the manual. The top of this page just tells us where the eligibility data is pulled from, which is the HIPAA Eligibility Transaction System, or HETS. If we scroll down, we see accessing eligibility, and this starts showing us how to check eligibility. So once you're signed up to use the portal, or if you're already signed up and maybe new to using the portal, this is a really good starting place for checking eligibility. If we scroll down a little more, I'm going to look under available eligibility information. You'll see the types of information that you can find under eligibility, such as deductible and other insurance information. I'm going to go down a little bit further under summary. So under summary, this image right here shows us the tabs that you'll see under eligibility. Like here you see the summary tab outlined in red for this section. Then there's the Part A deductible tab, Part B deductible, ESRD, and so on. You can also find other insurance information in these tabs, like the MSP tab here, which we'll talk about shortly. And then we have the MA tab, which is Medicare Advantage. These tabs are grayed out in this particular image, which means that this patient does not have this type of information, but if they had a Medicare Advantage plan, this tab would be blue like the others to indicate that there is information available on that tab. All right, back to the presentation. So aside from using the portal to check eligibility, you may also speak with your billing agency, clearinghouse, or software vendor about eligibility tools for Medicare that they have available, or your organization may sign up directly for HETS, which again is the HIPAA Eligibility Transaction System, which is the same system that the portal and other tools use to pull eligibility information. So this slide ties into what I just showed you with checking eligibility in the portal. You want to make sure that you're verifying other payers that might pay either before Medicare, which we're going to talk about on the next slide, or after Medicare, like a supplemental plan, or Advantage plans, which pay instead of Medicare. So first you'll want to check if the beneficiary has enrolled in a Medicare Advantage plan. Again, that card is going to look different than an original or fee-for-service Medicare card. We have the example here of a Cigna Medicare Advantage card, but that's just an example. Each card's going to look a little bit different based on that plan. If you have checked eligibility and find that the patient has a Medicare Advantage plan, make sure that you bill the Advantage plan. These plans are replacement plans, meaning they replace original Medicare, and the claim must be sent to that plan, not to Medicare. We did have a few pre-submitted questions on Medicare Advantage plans. One question was, do the Advantage plan payers have to follow Medicare rules for paying claims? So Advantage plans must cover at a minimum what Medicare covers, but may have their own guidelines and billing requirements. And we're not able to speak to Advantage plan requirements, so you would need to contact the plan for that. Another Advantage plan question was, if a patient has a Medicare Advantage, can I bill using their Social Security number, or do I need a specific ID number from the MA plan? And the same thing applies here. Check with that Advantage plan for their billing requirements. They may use their own member ID numbers. Also, check for supplemental plans, which are Medigap plans. These are private insurers that can cover the beneficiary's out-of-pocket costs, like their coinsurance and deductibles. You will need to include that information on your claim when there's a supplemental insurance so that the claim can cross over to that plan, meaning so it's sent to the Medigap plan after the claim is processed by Medicare. The next thing we want to talk about is Medicare Secondary Payer, or MSP. MSP refers to situations where another payer must consider the charges before Medicare can consider the charges for payment. Remember when I talked about the BCRC, where the beneficiary is responsible for keeping records up to date? This is a situation where that applies. If they have changes to other insurance, such as an insurer that pays primary to Medicare, meaning before Medicare, they will need to coordinate with the BCRC. Here we have the different types of MSP situations. After I talk a little bit about each of these, I will take you out to a resource on the CMS website to show you where to find this information. So first are situations where the patient is covered by an employer group health plan, or EGHP. The first type is working aged, where the Medicare patient is age 65 or older and covered through their current employment or a spouse's employment, and the employer has at least 20 employees. Another MSP situation under our employer group health plan category is someone with a disability who is under the age of 65, like maybe a child, and is covered either under their current employment or a family member's employment, like a parent. These plans are called large group health plans because the employer has at least 100 employees. Then we have those who are eligible for Medicare due to end-stage renal disease, or ESRD, and are under age 65. This one does not have a requirement for number of employees. For these Medicare beneficiaries, the group health plan is primary for the first 30 months of Medicare eligibility, meaning Medicare is secondary for the first 30 months of coverage. After the first 30 months, Medicare becomes the primary payer. For non-employer group health plans, these are not related to employment. They're related to an accident, illness, or injury and provide coverage only for the condition under that accident, illness, or injury. This includes no fault and liability insurance, workers' compensation, and federal black lung. If the service is related to the accident, illness, or injury that activated this type of insurance, Medicare is the secondary payer. For anything unrelated, Medicare is primary. So I want to show you a resource now that has a really nice chart of some common MSP coverage situations. I've asked Tom to add a link to the chat for the MSP fact sheet, and it is also linked in the MSP resources on slide 17. So feel free to follow along or save that link to look at later if you prefer. So I've opened that link up, and there's a ton of information in this booklet, more than we have time to look at today. What I specifically want to show you starts on page 4. This chart is something that can be really helpful in determining cases where Medicare might be the secondary payer. Remember we talked about employer group health plans? I mentioned that if the Medicare patient has coverage through their employment or spouse's employment, and the employer has at least 20 employees. You can find that here in this chart. So see here in this first row, we find that if the employer has less than 20 employees, Medicare is primary. I'm going to scroll down a little bit to the bottom of page 5. Here's an example we talked about. For a patient with ESRD who has a group health plan, Medicare is secondary, again, for the first 30 months. And then if we scroll down a little bit more, we see that Medicare becomes primary after 30 months of eligibility. There's another example I want to make note of just below that, which shows for patients with ESRD who have COBRA, the same thing applies. Medicare is secondary for the first 30 months and becomes primary after 30 months. So we're not going to go through all of these, but I wanted you to know this was here for you as a reference. We also have an entire playlist on our YouTube channel dedicated to Medicare secondary payer, and I have asked Tom to place a link in the chat to that playlist. All right, so here we have some MSP resources for you. First is a link to our WPS website for the MSP questionnaire. What you'll find here is a summary of your billing responsibilities in collecting patient information to determine if Medicare is the secondary payer. You will also find a link on this page that will take you out to the Medicare Secondary Payer or the MSP Manual, Chapter 3, which has model admission questions to ask the patient in order to determine who is primary. And this is one I do really encourage you to take a look at. While you're not required to use that specific set of questions, they could be really helpful in collecting information from the patient to determine who the primary payer is. One pre-submitted question asked, what the necessary forms are to have the patient fill out. While we don't have any standard forms, this questionnaire is one that you can use, or maybe even use that to create your own form. You just want to make sure that you're collecting all of the information that we've talked about so that you know who to bill first. Next, for MSP resources is the MSP fact sheet, which is where we just looked at that chart. Also, we have our page on the Benefits Coordination and Recovery Center, or BCRC, which has more information on coordination of benefits. You can also find BCRC contact information from that page if you need to refer a patient to the BCRC to update their insurance information. Excuse me for just a moment. Sorry about that. I had a little tickle in my throat. Last here is the portal user manual, and we did look at that earlier. The portal again has an MSP tab under eligibility, which gives you information on insurers who must consider your claim for payment before it is sent to Medicare. All right, moving right along. The next thing you'll want to consider is when Medicare is primary, meaning there's an insurance that pays after Medicare has processed the claim. You will need this information for claim submission, again, in order for that claim to cross over to the other insurance. Some examples of when Medicare is the primary payer include COBRA for patients age 65 and older or disabled. Remember, there's an exception, though, for patients with ESRD who have COBRA coverage, which we looked at in that chart in the MSP fact sheet. So again, I really encourage you to reference that chart. Medicare primary could also include TRICARE if they're not on active duty. There are, however, situations where TRICARE is primary, which are listed in that fact sheet. Medicare is also primary to retiree plans, supplemental plans, and it's always primary to Medicaid. The portal gives information on insurers who pay after Medicare in the supplemental insurance tab. And this information is in the same section of the user manual that we've already looked at. Another thing you may need prior to claim submission is an Advanced Beneficiary Notice of Non-Coverage, or ABN. You will have situations where you're providing a service that you expect Medicare will deny. An ABN provides the patient with advance notice of their financial liability for that service. The form is presented before the service is provided and helps the patient make an informed decision. The patient will select one of three options on the ABN, which are: 1, to indicate that they still want the service and for Medicare to be billed, or 2, they want the service and do not want Medicare billed, or 3, to indicate that they do not want this service. If after the ABN is presented and the patient decides they still want the service, a properly executed ABN transfers financial liability from the provider to the patient. The ABN is also called the CMS R131 form, and I've provided a link on this slide for the form. We do have information about proper use of the ABN on our website, and I've included a link in the last bullet on this slide. Here I have included when an ABN is mandatory versus when it's optional. An ABN is required to transfer financial liability to the patient when the service is not reasonable and necessary, meaning it's not medically necessary according to Medicare policy. This would include Medicare coverage as outlined in the National Coverage Determinations, or NCDs, Local Coverage Determinations, or LCDs, and CMS publications such as the Internet-Only Manuals, which are the IOMs. An ABN is also required for custodial care and when exceeding frequency limits, meaning providing services more often than allowed per Medicare policy. There is a full list of when you must issue an ABN in the CMS Advanced Beneficiary Notice of Non-Coverage tutorial, and I've got that linked here on the left side of your slide. An ABN is not required when the service is non-covered or fails to meet the definition of a Medicare benefit. Now, you may still provide an ABN as a courtesy in these situations, but the patient will not select an option and will not sign the form. We're sometimes asked, well, how do I know if something is non-covered? I'm going to go out to the CMS website, which is where providers would find Medicare information. So we'll start from the CMS website, which is cms.gov. From here, I'm going to click on this down arrow by Medicare, then Regulations and Guidance, and then I'm going to select Manuals. Now you can see this column on the left-hand side. I'm going to click on Internet-Only Manuals. So if you hear us referencing Internet-Only Manuals or IOMs, these are the manuals we're referring to. And we're looking for the Benefit Policy Manual, which is publication 100-02. From here, I'm going to scroll down and I'm going to select Chapter 16, which is General Exclusions from Coverage. So this tells you what is not covered by Medicare. And I won't read through all of these, but this whole chapter provides information on what is not covered. So if you see a service listed here in this chapter as non-covered, then an ABN is considered optional, but may be given as a courtesy. Remember, if you're giving that as a courtesy, you won't ask them to select one of the three options, and they should not sign the form. So for the pre-submitted question asking if there is a list of covered procedures that Medicare will pay for, again, there isn't really a list of what Medicare will pay for, but there is this list of what's not covered by Medicare. If this is for your patients, again, I would refer them to medicare.gov, and then they could find the covered services like I showed earlier in the presentation. All right, heading back to our presentation. Next, let's look at how you will submit your claims, meaning either on a paper claim form or electronically. For your professional claims, you will be using either the 1500 paper claim form or 837P electronic transaction. We had several pre-submitted questions on minimizing mistakes to submit clean claims. You'll want to use the resources I show you in this section of the presentation, which will help you with what fields are required, whether you are submitting on paper or electronically. First, let's talk about paper claim submission. Professional claims are submitted using the CMS 1500 paper claim form. We received a pre-submitted question asking about the differences between the Part A and Part B claim forms. This session is focused exclusively on Part B billing, which would be the 1500 form for paper claim submission. We won't be covering the Part A form in this session, and that would be the UB04, but our colleague Aline is presenting a separate session right now for Part A on institutional billing, which includes the UB04. The recording of her presentation will be posted on our website and YouTube channel, again in the next week or so. So if you're looking for more information on Part A billing, that will be a really great tool for you. So for the 1500, let's go back out to the CMS website again to see where you're going to find your information for submitting professional claims using the 1500 claim form. So I'm just going to go back out to cms.gov, and I'm going to go to Medicare, Regulations and Guidance, Manuals, there we go. Hopefully this is starting to look familiar. And I'm going to click on Internet-Only Manuals, and we're looking for the Medicare Claims Processing Manual, which is publication 100-04. And for this one, I'm going to scroll way down, pardon my scroll, to chapter 26. Here we go, which is completing and processing Form CMS 1500 dataset. So once we've opened chapter 26, I'm going to scroll down past the table of contents to page 2. You see right off the bat, it gives us information on electronic claim submission. The Administrative Simplification Compliance Act, or ASCA, requires that all claims are sent to Medicare electronically unless certain exceptions are met. Providers meeting one of these exceptions must request an ASCA waiver. I did include a link to our website on slide 22 with more information on ASCA waivers. So I'm going to scroll down to page 4. Oh, one more page. First, remember earlier when I was talking about the Medicare card, I mentioned something called the HIC number. You see it is referenced here where it says health insurance claim number. And this points out that for the purposes of this manual, the Medicare identification number refers both to the HIC number and the MBI. So even if you have payers that still use the HIC number, remember that Medicare now uses the MBI. So that's what you'll use for your Medicare claims. If you're submitting your claims using the 1500 paper claim form, this is what I really want to point out here. This section gives you detailed information on what is needed for each field. It gives you more details than what you see on the form itself as far as what you're required to put in each item, and will tell you when an item is required. For example, you see here in item 1A, it says to enter the patient's Medicare beneficiary identifier, which again is the MBI that you'll get from their Medicare card. And this tells us that the MBI goes into item 1A, regardless of whether Medicare is the primary or secondary payer. It also indicates that this is a required field. So each of the items are like that. They'll give you details on exactly what they're looking for in that field and then tell you if it's required. So if you're new to filling out the 1500 form, I'd suggest pulling this chapter up and you can look again item by item on what to include in each field. We had a pre-submitted question asking if there's a cheat sheet or an FAQ for which boxes are required. This is what I would recommend using as your cheat sheet. We had another pre-submitted question that just said 837P Box 10 information, COB info. I wasn't really sure what you were looking for, but if by box 10 you meant that you're looking for information on what to put in item 10 on the 1500 claim form, you'll want to use this as your guide. So I'm going to scroll down to page 6. And it tells us that item 10, scroll down a little bit more, requires checking yes or no boxes, and that if you check yes, you must add the primary insurance information to item 11. All right, let's head back to the presentation. I did include a link on this slide that will take you directly to the Claims Processing Manual, Chapter 26, that we just looked at. We also have, again, information on our website for the ASCA waiver requirements that's linked in the second bullet. So that's where you'll find information on exceptions to the electronic billing requirement. And then the last link here is to a page on our website that gives you the printing standards for the 1500 claim form, such as the font and ink color and proper alignment. As I mentioned on the last slide, the Administrative Simplification Compliance Act, or ASCA, requires that all claims are sent to Medicare electronically. Providers submit claims electronically using a HIPAA-compliant Electronic Data Interchange, or EDI format, usually through a clearinghouse, billing service, or by filing directly using a vendor software program. WPS has created a cross-reference guide to help providers comply with claim submission requirements. This guide is available on the WPS Medicare Electronic Data Interchange, or EDI page. Actually, let's go out and take a look at that. So I'm going to go back to our website, WPSGHA.com, and I'm going to look over here in the quick links, and click on EDI. This takes you to our WPS EDI website, and I want to look specifically at the Medicare EDI page. So there's information on the EDI process under Getting Started. The second bullet here is to enroll for electronic transactions, which keep in mind is separate from provider enrollment, which Leanne talked about in a session earlier today. This also has an enrollment guide, and then the companion guides will help with how to correctly format your electronic claims. Now the crosswalk is what I really want to show you here, and that's this first link under Medicare resources for the 1500 to 837P crosswalk. When I open this, you see this chart with all of the 1500 claim form item numbers listed in the first column, and the narrative description for that item number is in the next column. Then in the third and fourth columns, you have the data element and loop. Many of you indicated you were wanting to avoid rejections. The next column here for status, this is key to avoid your rejections. An R in this column indicates it's a required data element and it must be included in order for the claim to process. If these data elements are missing, the claim will reject. Didn't mean to leave that page. We had a question that asked if 24A has to be filled in for an office or outpatient visit. So I'm going to go to page 7 on this crosswalk. And item 24A shows that it is a required field for your electronic claim. So that must be complete in order for your claim to process. Also, if you want to check in Chapter 26 of the Claims Processing Manual, where I showed you on the last slide each of the 1500 form items listed out, item 24A instructions indicate that this is a required field on the 1500 claim form. Last thing I want to point out, an S, if you see an S in this column, that indicates that that is situational, meaning the field is only required if certain conditions exist, for example, the patient having another insurance. All right, now I'm going to head back over to the presentation. We had a couple pre-submitted questions regarding submitting claims electronically, which were, what happens with documentation submitted electronically with an initial claim? And is it better to wait for documentation to be requested? So there are situations when more information might be needed to process your claim, and you can include this by using the PWK segment of your electronic claim. We have a reference on our website which tells you about some common situations that might require additional documentation. And you could find this if you were to go to our website and type in PWK in the search field. Here we have some tips and tricks for Part B claim submission based on some common errors that we see. First, make sure you file your claim timely. Timely filing means the claim must be submitted within 1 year of the date of service. Claims that deny based on timely filing do not have appeal rights, so this one is really important. We had a question which asked, how long do we hold claims when a patient has updated their coordination of benefits? If you're holding the claim while the BCRC is updating the records, what I will tell you is not to miss timely filing, since you would not have appeal rights. If you have to submit the claim to Medicare before the update is made and receive a denial, at least then you do still have appeal rights. There are limited exceptions to the timely filing requirement. Let's go out and take a look real quick at where you can find those exceptions for timely filing. So I'm going to just open up the CMS Internet-only manuals, which I've shown you how to get here a few times. And we're going to go into the Claims Processing Manual again. But this time we're going into Chapter 1 for General Billing Requirements. All of Section 70 in this chapter provides information on timely filing, but what I want to specifically show you is in Section 70.7, and that starts at the bottom of page 189. I'm not going to scroll, I'm just going to type that in up here. So you can see here it lists the timely filing exceptions labeled 1 through 4, which are administrative error by Medicare, retroactive Medicare enrollment, retroactive entitlement involving state Medicaid agencies, and retroactive disenrollment from a Medicare Advantage plan. And then below that list, if I scroll down just a little bit here, what you're going to see are subsections for each of those 4 exceptions for timely filing, starting with 70.7.1 for administrative error and so on. All right, back to the presentation. We also received a lot of questions about top Part B denials and rejections. So I did pull some Part B claims data and found that our top denial for Part B was overwhelmingly denials when the patient is in a period of managed care, meaning they have a Medicare Advantage plan. My best advice on this is to follow the steps we talked about in collecting information from the patient and verifying eligibility. Do not submit the claim to Original or Fee-for-Service Medicare if the patient has a Medicare Advantage plan. You're going to need to bill that plan. Our top Part B reason for rejection is claim lacks information needed for adjudication. So that means something is missing that's preventing that claim from being able to fully process. And you could use the EDI crosswalk for your electronic claims and make sure that any item marked as required on the crosswalk is included on your claim. And again, Chapter 26 in the Claims Processing Manual gives you those required fields for your paper claim form. Another tip we have for you here is noting the difference here on the requirement for the MSP field. For your 1500 claim, this is item 11 and is a required field. If there is not insurance primary to Medicare, CMS requires that the word none be entered in that field on the 1500 claim form. For your electronic claims, you'll leave this field blank if there's no insurance primary to Medicare. So make sure to remember that you have our crosswalk available with the status field of required or situational. Remember, if the field is marked as required and you leave it blank, your claim will reject. These fields are needed in order for the claim to process. My last tip is related to what we talked about for ABNs. If you believe Medicare will deny your service because it's not medically necessary, and you've obtained a valid and signed ABN from the patient, you would include modifier GA on your claim. For services provided that are statutorily excluded or non-covered, you would append the GY modifier. If you provided your patient with an ABN as a courtesy for a non-covered service, use the GX modifier. And remember, for those non-covered services, you'll have that IOM that I showed you. That was Chapter 16 in the Benefit Policy Manual. And then lastly, if your service is not medically necessary per Medicare guidelines and you did not obtain an ABN, modifier GZ is used. All right, out of respect for everyone's time, we'll not get to live questions from the chat today, but again, we are having a follow-up Q&A session next week for questions from today's Education Expo, and registration is still open for that event. I will also review any unanswered questions submitted in the chat, and I'll send answers out to everyone in attendance. In a few minutes, you will receive an email to thank you for attending, and you don't want to delete this one without reading it. That email will contain your certificate of achievement, and it'll look like what you see here on your screen. We'll have your name and contact hours if you need to turn it in for credit towards continuing education units. If you do not receive the email, a few things may have happened. First, you may want to check your spam or junk folder. Be sure to add messenger@webex.com to your safe sender list so that any future messages will show up in your inbox. Also, if you joined by phone only, you would not have received this email, as there's not a way for us to capture your email systematically from the attendance record. No need to worry though. If you joined by phone, you are able to email us with the phone number you joined with, and Tom will be adding that email address to the chat in a few moments, and we have it listed on the next slide. If you do think of any additional questions, you have 7 days from today to submit those. You'll send those into our education mailbox and make sure to include "Through the Fog, Unveiling the Secrets of Part B Billing" in the subject line so that they make sure those emails come to me. Please keep in mind that I'm not able to access any claims history, so you will want to contact customer service for any claims related questions. All right, lastly, please take a few minutes to complete the survey. Tell us what you liked, what we can do better, and suggest topics for future education. You have a few different options to take the survey. You can use the link in the chat, or when you exit today, you'll be prompted to go to an external site, and that external site is the CMS Qualtrics page. The prompt will look like the picture we have shown here with a little yellow triangle. We included that image so you know that this is safe, it's not malware or anything like that. For those listening through our website or through YouTube, you also have the same opportunity to provide feedback. You will have a survey card at the end of the presentation. If you're on YouTube, you can scroll to the end to see that link. And then the link is also available in the description from the YouTube video. We do make changes based on your survey feedback. Here we've included just a few changes made recently. Based on survey comments, we added chapters to our YouTube videos so you can easily find specific information that you might be looking for within the video. Also, we've added training indicators to our education so that when you're registering for an event, you can better understand if it's relevant for you or not. We have also started our all-day virtual education events, such as this one, based on survey feedback. All right, that concludes our presentation. On behalf of myself, Tom, and all of our provider outreach and education team, thank you so much for joining us. We look forward to your survey comments and hope to see you at the remaining sessions today. You may now disconnect.